Yahala Voice is welcoming Dr. Rashid Abu Shanab and his team for his weekly show.
أهلا ومرحبا مستمعينا الأعزاء في حلقة جديدة من برنامجنا الأسبوعي يا هلا مع الدكتور أبو شنب. معكم من إذاعة ياهلا فويس يولي ريحاني في التقديم وخالد خلفة في الإخراج، وأكيد ضيفنا راعي البرنامج الدكتور رشيد أبو شنب. أهلا وسهلا دكتور.
هلا كيفك اليوم؟
الحمد لله تمام. دكتور رشيد أبو شنب, chiropractor in the Bridgeview area since 1998. Bridgeview Medical Plaza offering chiropractic services, acupuncture, massage therapy, weight loss, vitamins, herbs, decompression treatment, and physical therapy. This program is sponsored by the Bridgeview Medical Plaza. Bridgeview Medical Plaza offers dentistry with Dr. Saleh Akhras and Dr. Rabih Salama, pharmacy services with Dr. Maryam Abdelraziq and Dr. Osama Zarab, who recently joined the plaza. He is a medical provider for all patients with high blood pressure, urgent care, arthritis, diabetes, heart conditions, lung and respiratory conditions. Zarab Medical Center located at 7124 West 83rd Street, Suite C in Bridgeview of Harlem and 83rd. The number is 708-249-6777 in the Bridgeview Medical Plaza. And there is a new website for the plaza, bridgeviewdoctors.com. Again, bridgeviewdoctors.com. And Dr. Rashid, we have a guest today, Dr. Zubair Sadiqi, and he is located in the Romeoville office. Hello, Sahla. Welcome to the show, Dr. Zubair.
Good afternoon. How are you guys doing?
We're good, thank you. Dr. Zubair, could you tell us more about your work at the Romeoville location, please?
So I recently joined Dr. Abu Shanab at the Romeville Clinic. I graduated in 2014 from National University.
Mm-hmm.
I'm certified in acupuncture and rock tape, which is a form of KT taping. I like to do functional rehab, supplementation, and diet. So I'm not just limited to musculoskeletal conditions. I like to work with the internal function as well, whether the gut or the immune system.
Mm-hmm.
Another thing I do, I am fluent in Urdu for the Pakistani and Indian community around the neighborhood.
Mm-hmm.
And I like to work with everything from a broad-based aspect.
Thank you, Dr. Zubair. Again, I want to congratulate Dr. Rashid Abu Shanab on his new center with his associates. You opened the center almost 2 months ago. Could you share with us how are things in the center right now?
Sure. Actually, it is, mashallah, huge, 8,500 square feet.
Mm-hmm.
We have the medical doctor, Dr. Osama Zarab. He was a great plus to the office. We are not limited to musculoskeletal, like Dr. Zubair said. We definitely do blood pressure, diabetes, heart disease, pulmonary, lung disease, anything we can help. We also have the dental with Dr. Rabih Salama from the north side. I think this is his 5th location,
Mm-hmm.
as well as Dr. Saleh Akhras as well. He's from the north side as well. And pharmacy through Dr. Maryam Abdelraziq. She has a location in Orland Park, and this is her 2nd location. So, mashallah, we are definitely doing nothing like this in the Bridgeview area. If we can do anything, we accept most insurances. So if you have any problem, if you have any medical condition,
Mm-hmm.
you don't even have to have an appointment. Stop by the clinic. We'll be more than happy to get you checked out and see what's a problem, and we can go forward.
That's great. Today's topic, دكتور, will be about chronic sciatica and back pain. بالعربي رح نحكي عن عرق النساء أو السياتيكا وآلام الظهر المزمنة.
Yes.
And first question, what is sciatica in general? Could you explain to us, please?
Sure. Sciatica in general, or وجع الظهر عرق النساء,
Mhm.
it's literally a pain in the butt. Most of the pain starts in the buttock region.
Yeah.
So the term sciatica is not a diagnosis per se, but actually it's a description of irritation of the sciatic nerve. And yes, it means the pain starts from the back, in the buttocks, down the leg, to the foot. So it's the whole distribution from the back to the buttock, all the way down to the top of the foot.
Mhm. It's very common. I know a lot of people that complain about this. They keep on saying, "Oh, I have sciatica. I have sciatica." I don't know if they know what it means, how it's treated, but they just complain about it. So, Doctor, where is the nerve exactly? Is it in the back or in the buttocks area?
You know, the sciatic nerve is the largest nerve in our body. It's created by a contribution from spinal nerves that originates in our lower back and sacrum, which is like the tailbone area. And the nerve fibers from the L3. The L3, it's exactly about an inch lower, the inch higher than your belly button. So if you're looking at your belly button, 1 inch higher than that, that's where L3 is. So from L3 all the way to the tailbone to about S4, this is all joined together and run down to the back of our leg as the sciatic nerve. And then just above the knee, the sciatic nerve splits into like a tibial nerve and a peroneal nerve, and that goes all the way to the back of the leg and the bottom of the foot. And the peroneal nerve goes to the front of the leg and top of the foot. But I would like you
Yeah.
to say all this again.
I don't think that I can, but it makes sense because it's all related. Some people say that they have the pain in the back, that it's in the back. Others say that it's in their leg or top of the foot. So it's everyone says something different about the sciatica and the nerve itself, where
Right.
the pain is located. So, Doctor, what more symptoms they might have?
You know, that's a good question because exactly how you said it, it's not specific. It's in the back. It's in the buttock. It's not specific because it's a bundle of nerves coming together. But because the sciatic nerve covers so much territory, it can cause a wide variety of symptoms, like the buttock pain, like we said, pain in the thighs, pain in the lower leg or the foot, or even weakness in the leg or foot. You know, some people, like they used to say, oh, I used to drive my car with no issues, but now I have a foot drop, you know, where my foot, it's like heavy. So this is definitely an issue we have to look into, and this is a serious condition.
Does it have another name? It's also called sciatic neuritis?
Neuritis.
Neuritis.
Yes.
Right.
Actually, this is question from Hikmet Abu Shamat. He asked this question about that, and hello, Hikmet, and thank you very much for your comment. Yes, it is. Although term sciatica means there is inflammation to the nerve, but the most common cause of the inflammation is the pressure and irritation as a result of disc arthritis and herniation. So pathological causes such as cancer that has metastasized from the stomach, like Dr. Siddiqui mentioned, it comes out from the stomach or the genital area, genital urinary symptoms, as well as tumors or infections of the nerve that can be all related to it. But we have to rule this out. We have to be sure there is no problems from the prostate, there's no problems with the stomach issue. So the vast majority of the cases causes the inflammation is either mechanical or compressive, not like cancer, God forbid, or anything of that nature. The sciatica is mainly because of arthritis, disc herniation, injury due to a car accident or work injury.
Can it happen just for no reason? Sometimes I feel that I have sciatica
Well, absolutely. It
from
comes,
exercise or
Yeah,
from sitting
yeah.
long hours.
You're absolutely correct because it's in the buttock region, tightness around a muscle called piriformis muscle. That pinches the nerve, and that section definitely give you the same symptoms. So it could be a muscle tension, could be the arthritis, could be the disc herniation. So it's definitely a broad-based condition that need to be looked into further.
Yeah. Well, sometimes I put a hot pad or I massage that area with oils. I think it helps sometimes.
You're absolutely correct.
Yeah. I would like to remind our listeners that this show is sponsored by the Bridgeview Medical Plaza, Dr. Rashid Abu Shanab, located at 7124 West 83rd Street in Bridgeview, off Harlem and 83rd. The number is 708 249 6777. بحب أعيد رقم العيادة بالعربي 708 249 6777. The new website bridgeviewdoctors.com. So, Dr. Rashid, going back to the causes of sciatica, could you tell us more about the causes?
Sure. Most commonly is mechanical. Mechanical inflammation is caused by abnormal alignment and motion of the spine. Just like you mentioned something about when you sit or stand or something, you're crooked to one side or the other, that can give an immediate muscle tension, and that can give you the same symptoms if it's pressing that nerve.
Yeah.
So that's the first one. The second one is compressive inflammation, and this is the compression due to a disc or ligament or kind of spurs because of arthritis around the spinal cord. So that's another common one that we see. A third cause is something called stenosis, which is narrowing of the spinal cord. If you look at the spinal cord, comes from the brain down the spinal cord. It's like a hose. So if that hose become a little bit smaller because of arthritis, that causes something called stenosis of the lower back, and that can cause the same symptoms on sciatic if it's one side or the other, or even both. Another thing is something called slippage of the vertebra, where the bone goes too much forward, and this is very common with females, actually, with high heels, 3-4 inches, So, and
It is not healthy to wear high heels.
it's really not, especially if somebody suffer of lower back pain or sciatic pain or foot pain or bunions or anything of that nature. It looks good on Saturday night maybe, but the rest of the days.
But the same thing with the flat shoes, right?
Not
really?
as much. No, you're trying, Yulia, so much, but the answer is no.
I like high heels.
So spondylolisthesis is also called. It's the slippage of the vertebra. When the bone it become defected because of the too much weight, not the weight of the body, but the weight of the bone going too much forward, that also can compresses the nerve. Other causes is the arthritis of the disc as well, and that, as I mentioned earlier, it pushes the compression on the nerve, and that's the one that contribute the most common factors of the spinal stenosis. And lastly, what we indicated earlier, something called the Piriformis Syndrome, which is the condition that the sciatic nerve is irritated by the compression from the piriformis muscle. And that piriformis muscle, exactly, it's in the buttock region, right in the middle of the buttock. So compression of the sciatic nerve by the piriformis muscle is classified as an entrapment neuropathy.
So, dear listeners, if you're suffering from sciatica, neck, and lower back pain, auto or work-related injuries, numbness, and tingling, give Dr. Rashid Abu Shanab a call at 708-249-6777, and their website of the Bridgeview Medical Plaza is bridgeviewdoctors.com. إذا كنت تعاني من آلام في الرقبة والظهر المنفصل، أو إذا كنت مصاب بحادث في العمل أو حادث سيارة، اتصل على دكتور رشيد أبو شنب على رقم 708-249-6777. متابعين دكتور رشيد معك بخصوص آلام عرق النساء وآلام الظهر. Could you tell us please about the x-rays? Can x-rays diagnose sciatica?
Absolutely, but before we do the x-rays, physical examination is really first. A thorough history, additionally specific biomechanical, orthopedic, and neurological tests should be performed. Careful examination will reveal signs of tension or compression on the sciatic nerve. We have to give a special attention to the gross losses of muscle strength. In particular, as I mentioned, the foot drop or the toes unable to, curl them down or up. So that's really a huge problem we see common with patients with sciatica. Something called muscle stretch reflex, the hammer. When you go to the doctor's office and this is very important.
And just move your feet.
Yeah, but it's an actual reflex, and this is the one we have to see, we have to test to be sure that there is a relationship of the brain down to the foot. So using that stretch hammer definitely help the deep tendon reflexes. And also we have to test the sensation. We very common ask the patient if they are able to feel our hands, or if it's like a sharp or dull or something. So all that is important in addition to the x-rays. And we love the x-rays, Yulia, to be standing up. I like the patient to be standing up, not laying down. With that, you can see it a little bit better, how their posture is, if they go into one side or the other. As you know, also, we brought Dr. Rafia Salim before with the MRI and the CT scan is very important also to check into disc herniation and arthritis. And lastly, there's something called nerve test, like electrodiagnostic studies, electromyograph, or nerve conductive velocity tests with the AMG and NCV. All of that together will tell us more information about the disc herniation and the sciatic nerve.
So the X-rays must do. You can't just do the first physical examination and that's it.
Well, the physical the X-ray will confirm the history and the physical. They kind of go back. They can go together, but the physical exam and the history is by far more important.
Mhm.
And to confirm what we're doing, we need the X-ray too. So they are all together. It's not one versus the other, or the X-ray will show it 100%. No, we need the history. We need to know what the patient is feeling. As I mentioned earlier, where's the pain? Is it in the buttocks? Is it in the back? Is it in the leg? All of that related.
Mhm. So after the physical examination, the X-ray, and the MRI, what is the treatment after all these diagnoses?
Well, depending on the cause. Depending on the cause of we mentioned all those 6 causes earlier. If there is one leg shorter than the other, we have to correct that. If there is any kind of misalignment of the bone, we have to correct that. So chiropractic treatment is actually over 60% of people with sciatica who didn't get relief from other therapies and tried spinal manipulations. They did experience the same degree of pain relief as patients who eventually had surgery. So chiropractic treatment by far does a great job. We see people about 3 to 4 times a week for the first 4 weeks, and then we re-examine them through an X-ray again to see the difference between their back or not. Then we can reduce down the amount of visits accordingly.
Mhm.
So the chiropractic. Have you had chiropractic adjustments before, Yulia?
No, never.
Well, we have to work on you too, but
Yeah.
spinal manipulation.
That's why I have the sciatica that comes and goes. And doctor, how about the decompression and the acupuncture? Do they help to treat the sciatica?
That is really a good question. Spinal manipulation may create a response in the nervous system that relieves the pain and restore normal mobility in the
Mhm.
injured area. It's like when you go to your side and we adjust the spine, when we, نطق الظهر العمود الفقري على
Mm.
اليمين وعلى اليسار عشان نخفف the pressure على الظهر, that reduces the inflammation and that creates an environment to promote the body's natural healing and decrease the inflammation. However, sometimes we are unable to do such reaction. We cannot adjust the patient right away because it's too early. And this is when we use the decompression. And what is a decompression? It's actual table. It's a non-surgical table, and you lay on your back, and we
Mhm.
put a belt around your chest and another belt around your hips.
Mhm.
So imagine yourself laying down, and then the belt around your hips is the one that actually comes down all the way. It pulls you all the way down, and the one around your chest, it actually stays up there.
Mhm.
So with that, it will pull the spine, and that creates a vacuum to the disc and to suck the disc material back in to decrease inflammation.
Does this procedure hurt?
In the beginning, when you lay on it, it's not, but maybe when you get off the table, it does. But that's why we do it right away. Then after that, we use the heat, the electrical stimulation, and that to decrease down the amount of protrusion and the amount of disc herniation. It's well documented, and it's a resort versus an injection. It's a resort instead of surgery. And you mentioned something about the acupuncture.
Right.
And I am certified acupuncturist, and Dr. Siddiqui as well in Romeville.
Mhm.
And you can get relief as soon as the first session. We see cases where patients with sciatic pain down the leg, numbness and tingling, and even tilted to one side and the other. We did one session, and some patients did excellent, and some patients who actually requires additional sessions, like 12 to 20 even.
Mhm.
So a lot of studies about this, especially the one in Journal of the Traditional Chinese Medicine, found that over 30% of patients with sciatica got complete relief compared to people who went into something else. But sciatica, you're dealing with muscle tension, you're dealing with disc herniation, you're dealing with arthritis, you're dealing with a lot of things. So treating it, it's not something easy or take a pill. It definitely needs a lot of work.
Dr. Rashid, your office offers the use of chiropractic adjustments, non-surgical decompression, functional nutrition, massage therapy, and cold laser treatment. With a comprehensive treatment plan, once pain is under control, Dr. Rashid's office begin transitioning treatment to correct the underlying biomechanical problems. Please call 708 249 6777. And Dr. Rashid, the last question regarding sciatica. Is posture important in this case?
And this is a great question, Yoli, again. Posture had to do a lot. Imagine yourself, standing up in front of a mirror. Stand up on one foot and look at your body. See how you are at. Maybe you are tilted to one side or the other. Then stand to the other foot and see how you stand. So normal posture does a great because your weight distribution, it's equally to both sides. So our chiropractic biophysics is a crossover of chiropractic and physical therapy procedures, and that consists of for you to stand in the front of a mirror and try to do this kind of exercises. Try to do a posture training. You can do even some push-ups. You can do a little bit postural traction to rehab some of the ligaments. So posture has to do a lot with it. We talked about high heels. That will not going to make a good posture. So,
it looks like you have a good posture when one is wearing high heels.
Possibly, but it will make the spine to go a little bit too much forward, and it's not really
Once you take off those heels, you have big problems.
Some people feel worse, without heels versus some people say, oh, I can run, I can push, I can do everything with high heels.
Yeah.
So
they're used to the high heels.
So that's something that for some reason, some people, maybe it's good, that they wear it, but it's not overall functioning.
Healthy, yeah. And finally, Doctor, what are your recommendations for the sciatica solutions?
Because of the complexity of the nature of the cause of the sciatica and the diverse treatment that are often necessary to successfully resolve it, sciatica is often a pain in the butt. For the doctor as well as the patient, because it's not specific, it's all over. So treatment with oral medication or injection is often it's not as effective or has the best result. Possibly it's good for temporary relief, but there is a lot of conservative treatments that we have to look into. Many chronic sciatic pain sufferers have been able to find long-term relief through chiropractic, through decompression, through physical therapy, maintaining a great posture, changing their shoes. It's probably apparent at this point that treating sciatica successfully begins with the right diagnosis. So if you or someone you love is suffering with sciatica, I invite you to contact our office and schedule a complimentary consultation. I'll be more than happy to examine it and x-ray it and see what's needed to help you out.
Thank you, Dr. Rashid. To our listeners, get the relief you need today. Dr. Abu Shanab and staff, just a call away. 708-249-6777. And before we wrap up, I would like to remind our listeners that the program is sponsored by the Bridgeview Medical Plaza. Bridgeview Medical Plaza offers dentistry with Dr. Saleh Akhras and Dr. Rabih Salama, pharmacy services with Dr. Maryam Abdelraziq and Dr. Usama Zohrab, a medical provider for all patients with high blood pressure, urgent care, arthritis, diabetes, heart conditions, lung and respiratory conditions. Zohrab Medical Center located at 7124 West 83rd Street, Suite C in Bridgeview. The number is again 708-249-6777 in Bridgeview Medical Plaza, and the website is bridgeviewdoctors.com. And I also would like to remind our listeners regarding the phone number of the Romeoville office. The phone is 815-293-3000, and the address is 600 South Weber Road, Romeoville, Illinois. بهيك مستمعينا الأعزاء ننهي حلقة اليوم من برنامج يا هلا مع الدكتور أبو شنب. Thank you so much دكتور زبير صديقي for coming today. Thank you so much دكتور رشيد أبو شنب.
Thank you very much.
مني يوليا ريحاني ومن راعي برنامجنا دكتور رشيد أبو شنب ومن مخرجنا خالد خلفة أطيب المنى. استمعونا في حلقات قادمة وإلى اللقاء.